Welcome to Chapter 4, the Integumentary System. So this chapter, the objectives will be for you to be able to identify the functions of the skin, define terms related to the skin, layers, and accessory structures, define the word parts related to the integumentary system, define terms related to the integumentary system, and explain the abbreviation used in the integumentary system. Let's talk a little bit first about the anatomy and physiology. The functions of the skin are to protect the body from microorganisms, from harmful effects of the UV rays, and to prevent dehydration. Additionally, to produce vitamin D, the skin assists in temperature regulation and communicates sensory information. The organs and structures of the skin is the largest organ in the body. All of the skin combined weighs about 6 pounds. And the accessory organs of the integumentary system are the hair, the nails, the sudiferous glands, and the sebaceous glands. So the sudiferous glands are sweat glands, and the sebaceous glands are oil glands. There are 3 layers of the skin. The epidermis is the outer layer, the dermis is the deep layer, and the subcutaneous tissue is the 3rd layer, and it connects skin to the surface muscles. The subcutaneous tissue contains the blood vessels and fat. Continuing anatomy and physiology terms, the accessory structures include the arrector pili, which are a tiny muscle that attaches to the hair follicle, hair, composed of keratinized fibers that arise from the hair follicles, keratin, the protein found in the hair and nails that promotes hardness, and the nail, which is the translucent plate made of keratin that covers and protects the end of the fingers and the toes. Additionally, the sebaceous glands secrete sebum into the hair follicles and epidermis. Sebum, the definition is an oily secretion of the subcutaneous gland, and the surdiferous gland secretes sweat and assist in temperature regulation. Make sure you understand the layers of the skin and the accessory structures. Here is a figure that shows the hair, the epidermis, the dermis, and the subcutaneous layers, and then microscopically shows the pore opening of a sweat gland, the sebaceous or oil gland, the arrector pili muscle, the hair follicle, the sudiferous sweat gland, and adipose tissue, and then at the bottom you can see the nerves, the arteries, and the veins. And remember that the prefix epi means on, therefore the epidermis is the layer of skin on top of the dermis. So let's look at our word parts or our combining forms to help you through. So cryo means cold, cyano means blue, dermo, dermato, or cutaneo, referring to the skin, hydro, sweat, karat or sclero, meaning hard, onchio, nail, rhytid, wrinkled, sebo, sebum, tricho, hair, zero for dry, an, without or not, and you're going to see that throughout these word parts, throughout all the chapters, you're going to use some of them in each chapter. Bio for life, epi, like I said, for on or follow, para, around, beside, near, sub, below or beneath, derma, skin condition, itis, we've had that before, inflammation, malacia, Softening, plasia, formation or growth, plasty, surgical repair, reconstruction, flow, or discharge. So these are all your suffixes. And adjectives and other related terms include descriptive terms pertaining to skin conditions. We're going to talk a lot about those. Atypical means unusual, circumscribed, contained in a specific area, indurated, pertaining to an area of hardened tissue, and purulent, containing pus. Cyanosis, bluish color. Erythematous, condition of being red. Eschar, blackened area of burned tissue. Pallor, abnormally pale skin or coloration. And terms related to injury, that includes abrasion, an injury resulting in removal of superficial layers of the skin. Burns, they're described based on the injury to the skin. A burn is an injury of the skin caused by heat or other means, but a superficial burn involves only the epidermis. A partial thickness burn involves the epidermis and dermis, and a full thickness burn involves destruction of the entire skin. Here is a picture of the different types of degrees of burn, and you can see the picture of the epidermis, the dermis, and the subcutaneous layers. So know the difference between the superficial burn, the partial thickness burn, and a full thickness burn. Additionally, terms related to injury is cicatrix, the fibrous tissue replacing normal tissues destroyed by disease or injury, commonly called a scar. A contusion is an injury without causing a break in the skin. An excoriation is a scratch mark on the skin. An abscess is a circumscribed collection of pus caused by a bacterial infection. A carbuncle is a collection of large localized abscesses seated in groups of hair follicles and connected by channels. Cellulitis is inflammation of the subcutaneous layer of the skin, and a furuncle is an infection of a hair follicle. So you're going to see some pretty pictures throughout these chapters. So here's a picture showing you what cellulitis looks like. Additionally, some other symptoms and medical conditions include herpes simplex, which is an eruption of blisters on the skin and submucous membranes caused by a local infection of the herpes virus. Herpes zoster is a viral infection that affects the peripheral nerves and causes an eruption of blisters that follows the course of the affected nerves, commonly called shingles. Impetigo or impetigo is a contagious bacterial skin infection. So here's a picture of the herpes zoster, the shingles, and the impetigo. Additionally, peronchia is an inflammation and infection around a nail due to bacterial or fungi. Tinea is a fungal infection of the hair, skin, and nails. Tinea capitis is a fungal infection of the scalp. Tinea pedis is a fungal infection of the feet, commonly called athlete's foot. Lesions that are raised or elevated are defined by a cyst, which is a closed sac that contains liquid or semi-liquid substances. A papule is a small, raised, solid, circumscribed area of the skin. A pustule is a small, circumscribed elevation of the skin containing pus. And urticaria is an eruption of itchy wheals, usually related to an allergy and commonly called hives. Here's a picture of the papules. On the right, the cyst. And additional lesions that are raised or elevated is urticaria, is the eruption of itchy wheals related to an allergy. Verruca, the flesh-colored elevation of skin caused by a virus. A vesicle is a clear fluid filled raised lesion. A wheal is a raised reddish lesion that often changes in size and shape. So on the left is the picture of the vesicles, right picture of something described as a wheals. So what are some common tests and procedures of the integumentary system? Often you hear of a biopsy, which is the removing of the skin from a patient for a microscopic exam. A frozen section is a thin slice of tissue cut from a frozen specimen used for rapid microscopic diagnosis. The scratch test is an allergy test where an antigen is applied through a scratch in the skin, usually to test for allergies. Tuberculosis skin test is an intradermal test to determine whether a patient has tuberculosis or has been exposed to the disease. Very often healthcare workers, if you work in healthcare, you're all going to have a tuberculosis test. Surgeries and procedures related to the repair of the integumentary system is a dermatoautoplasty, which is a graft transplanted using the patient's own skin. Dermatoheteroplasty is a graft transplanted using skin from a source other than a patient, and a dermatotome is an instrument used for cutting thin slices of skin for grafting or excising small lesions. So here's a picture of a dermatopone preparing skin for grafting, and the dermatotome is that tool. Additional surgeries and procedures related to the integumentary system include dermatoplasty, which is surgical repair of the skin. Rhytidectomy is a surgical removal of wrinkles. Rhytidoplasty is a surgical repair of wrinkles, and a suture is used to unite two surfaces by sewing. So here's some different types of sutures, A through F, in plain continuous, plain interrupted, lock stitch continuous, mattress interrupted, and retention suture bridge. So what are some medication and drug therapies associated with the integumentary system? An antifungal is a type of medication used to treat parenchyma, tinea, or tinea capitis, or tinea pedis. An anti-inflammatory might be used to treat inflammation in acne, cellulitis, eczema, and other skin condition. An antipyretic is used to treat itching due to eczema, scabies, urticaria, and other condition. A pediculicide is used to kill lice. A steroid is used to treat many inflammatory skin conditions. So what are the specialties and specialties? Well, the specialty is usually dermatology, and that's a medical specialty focusing on the study and treatment of disorders of the skin. A dermatologist is a physician who specializes in dermatology, and a medical esthetician is a licensed professional in the field of cosmetic beauty. Common abbreviations would be BX for biophysies, CNS is a culture and sensitivity, ED&C is an electrodesiccation and curettage, FS is a frozen section, IND, incision and drainage, PPD is a purified protein derivative. And that's the integumentary system. Good luck this week.